Welcome, everyone. I am Bob Wurzelbach, the Director for the Office of the Respect Life Ministries for the Archdiocese of Cincinnati, and this is our video podcast series that we call Being Pro-Life. This week, we have a special episode on rationing care in time of limited resources, and in particular, how that affects the disabled and other vulnerable members of our communities. As always, we have a special guest. Will you please introduce yourself?
Hi, Bob. I'm Ken Craycraft. I'm an associate professor of moral theology at Mount St. Mary's Seminary and School of Theology in Cincinnati, Ohio.
So, Dr. Craycraft, there's been some criticism in the news lately, for example, about Alabama and Washington State in particular. They put forth some guidelines, I think, specifically about the situation if it comes up where we have more people who need a ventilator than we have ventilators, or more people who need perhaps a critical care bed than we have beds. Alabama quote that I've read that received a lot of criticism recently said, quote, persons with severe mental retardation, advanced dementia, or severe traumatic brain injury may be poor candidates for ventilator support. So would you agree that critics were right to call that unfairly discriminatory?
I agree with the critics who call that unfairly discriminatory, to be sure. We do have to take into account various factors when we think about the scarcity of medical resources and what we call triage in determining who does and who doesn't get care if it's impossible to care for two patients in a given situation. But the criteria that you set forth that has been criticized is rightly criticized because those are not legitimate criteria that we use when we make determinations of who gets the one ventilator of the two people who need it.
Dr. Craycraft, so let's look at what are those principles then that we as Catholics want to consider when you're having to make these decisions. As an aside, I asked my daughter, 8-year-old daughter, real quickly, I said, what do you think if only one person can have this ventilator? And her first response was, well, the person who is most likely to die if they don't get it. So what are these principles that we need to use? Yes, go ahead.
That can be one, but it certainly is not the first one, because there are some cases in which the person who would most likely die if they don't get it is otherwise the least likely candidate, given the hypothetical situation, which is not so hypothetical, of one ventilator and two people.
Right.
Other factors that might go into it have to be things related to the expected lifespan of that person. Now, please understand, lifespan doesn't mean age. So if a person has a medical condition that is unrelated to the COVID-19, and treating that person for COVID-19 is not going to treat the underlying condition, and that condition is at or near terminal, then that's going to be a factor that we consider in making that decision between those two patients. And let me say this, and this will preface almost everything we say, Bob. All of these are hard decisions. I have a friend who's a physician who works at a veterans hospital, and he emailed me recently and said that lay people have no idea how bad it is. And this is in Ohio where it hasn't even peaked yet. So I just want to say, when I can sit here and make what it sound like fairly cold, rational distinctions like this, I don't want to minimize how difficult it is for healthcare workers who are having to make these decisions, nor to minimize how difficult it is for families for whom one of those patients is going to get the treatment and one of them is not. So these are difficult decisions. So one, we definitely would consider underlying pathologies. What we don't consider age. We don't consider mental capability. We don't consider factors that don't have to do otherwise with survivability. And all of those are condemned in Catholic moral thought, and they're condemned in ways that are often related, Bob. In fact, this is the best analogy to principles related to euthanasia or physician-assisted suicide. And, of the many things that are going to be said and written when all of this is over, and one of them is going to be more attention to advanced healthcare directives, healthcare powers of attorney, and appointment of proxies who are able to discuss these decisions ahead of time so that we're able to make decisions in the context of a crisis that we don't now anticipate, but we know now could happen in ways that we didn't expect. Now, of course, these still have to be consistent with Catholic moral theology, but it does make it easier for a health caregiver in a crisis situation to make those decisions if the patient that he's treating already has an advanced care directive, a DNR, a do not resuscitate order, or some other proxy, whether paper or human proxy, to be able to assist the healthcare worker in making those decisions. Catholic physicians and Catholic hospitals and other Catholic healthcare institutions are broadly guided by what's called the Ethical and Religious Directives for Catholic Healthcare Services, that is produced by the United States Conference of Catholic Bishops. It's in its 6th edition now, and it provides guidelines for advanced healthcare directives and other types of instruments that help plan in advance for situations in which a person is extremely ill or about to die. And certainly it's consistent with the traditional magisterial teaching, especially, again, in the context of scarcity of resources when there are too many sick people to be able to treat. That isn't to say, however, that there isn't a legitimate way that we can give advanced directives for purposes of not directly killing, either by commission or omission, but rather by allowing natural death to take place without an obligation to use what are called extraordinary means in order not to really keep alive, but really to prolong death. And in fact, most hospitals have, and the Catholic Medical Association recommends, protocols that determine when and if it's time to resort to palliative care for that particular patient rather than attempting to continue to cure that patient.
So, if you Google ethical and religious directives, you can find the entire voluminous online, the 6th edition. You could read that online if you're interested.
It's the 6th edition, and specifically what applies to the issues that we're talking about is Part 5. And it's important to note that the ethical and religious directives for healthcare, they're not just guidelines. They are, for many Catholic hospitals, they are really almost legislative in their power. And Catholic hospitals are required to abide by the ethical and religious directives.
So in addition to the ERD, is there another document we can see online?
Well, I think the best place to look on any life issues is Pope St. John Paul II's encyclical Evangelium Vitae. Any papal encyclical is also found just by Googling it, and usually the first hit will be the Vatican website of the official version. But also the encyclical Donum Vitae, the Gift of Life. In addition to that, one can go to the National Catholic Bioethics Center. The website has an abundance of resources. Some of it's behind a paywall or for purchase, but there's a lot of free resources there as well.
You search National Catholic Bioethics, it's the very first thing that shows up, but also it's at ncbcenter.org. That's the direct address for it as well. But anyway, here it is on the screen. And there are things that you can pay, but there are things that you can find on this site as well. And there's also a phone number for specific questions at time. There's the main line, 215-877-2660.
Very reliable, very consistent with the magisterium, very much thinking with the church in all their publications.
Thanks for talking with us today about how it is that we prioritize care, particularly in a time of pandemic like we're in right now, and how we make better healthcare decisions and try to prioritize according to a moral Catholic perspective and not according to some knee-jerk, you might say, reaction of that put people who are vulnerable and who are disabled at a risk, which we do not want to do.
Thanks, Bob. It's very good to be with you.
And I want to thank all of our viewers and listeners for tuning in on this episode of our Being Pro-Life series. Head to the website and view all the links talked about in this episode at www.catholiccincinnati.org/being-pro-life. Thank you again for joining us today, and I look forward to being with you next time.